Good morning. Hello, Sarha. I'm Dr. Zehra. I'm Dr. Zehra. I understand you have some pain.
Okay, so I think all of you have seen this long case, real case exam setting, that how the long case setting would be in the exam. And today, my name is Dr. Zara, and today we are discussing about the MRCPI Ops and Gyne long case, how you have to perform your long case, and some tips and tricks about the long case. Um, we will not discuss in the more detail, but some small tips that how to start your long case actually. So this is the starting point, and first you have to imagine, because you cannot see without experience of your exam, without attempting your exam, but you can imagine only the how the exam setting would be in the real exam. So the exam setting would be same like this, in which the video you have seen that two examiners are sitting opposite to the table. You are entering to the room and you have to greet the examiner, and you have be to be you have your look should be full confident, and it's your choice that you wanted to wear apron or not, or it's your choice that how the dressing should be. But it should be a formal dressing, and once you are entering, you should show full greeting to the examiner and introduce yourself to the examiner, and full confident to the examiner. Your looks should be a full confident. All right, and then on the table you can find, in the real exam you can find one paper. Here you can see on the side of the table the paper was attached, but usually on the table you can see in the real exam the paper will be there, and the scenario will be written there for the exam. That uh, in this video you can see that scenario is given that Sarah, she is 34-year old, and she presented with a complaint of chronic pelvic pain and vitals are normal. Now manage your case. So here we are discussing and starting with the chronic pelvic pain case. This obviously included in the gynec case, and it's your luck that what you are getting. There are two cases you can get, sorry, one case you can get either ops or gynae, and it's totally on the luck. All right, so let's start that how you have to proceed your case, and you how you have to start your case, and how the setting would be. So first talk about the setting. You have seen in the clip that how the setting would be. So let's discuss about the setting first. That two examiners are sitting opposite side of the table, and you have to enter the room. You will find the role player on the chair, not on the couch. And on the couch usually they are placing the mannequin for the examination. That we will discuss later, examination part. But the role player you can find on the side of the next chair on your side. Okay, then you have to read the paper. You have to make yourself calm and start your case. Always introduce yourself that with your name, and what's your setting. It's a setting is on the clinic, given that patient is came on outpatient department with a complaint of chronic pelvic pain. Then whatever the setting is given, or you can tell the setting that I am my name is Dr. Zara, and I am one of the doctor in the clinic today. And you can start making a rapport with the patient by asking a name and age. May I confirm your name and age? Although the name and age usually they are giving on the this paper, but you can reconfirm and start building your rapport with the patient. Okay, and you can tell her that is it okay to ask to call you Sarah, and that's how you have to start your case. Okay, then for the questioning, once you're starting the asking the question, my suggestion for you is to always start with the open-ended question. This is also one of the a good approach to ask the history to start. Even in your clinic also, it is a good way to start with the open-ended question. Can you describe me more about your pain? I know in the exam, in the real case, in the OPD, you can find a detailed answer from the patient, but in the exam, you will not find a detailed answer from the patient. You will find they will give you only one line of answer, that doctor, I have a pain in my lower tummy. Then again, you have to ask about the more about to explore this complaint. Can you describe me more about that pain, that either is a sharp, dull, or we will see in the next clip video. I will attach with this video. Okay, and so let's start that how to take your case further. We all know that long case would be 25 minutes, okay, in which you can give the 25 minutes long case, okay, and you can give 5 to 6 minutes, maximum 7 minutes to your history points, okay. Your history should be a very focused history. It should not be a very detailed, and it should not be a very small history that not giving you any clue about the management part or the diagnosis part. So it should be a focused history about your particular complaint, whatever the complaint is given. Here we can see that we are discussing about the patient Sarah, 34-year-old, presented with a complaint of presented with chronic pelvic pain. Vitals are normal, okay. Name and age, usually they are given in the paper. So you can start your case by reconfirming the name, that may I confirm your name and age, and then you can build up your review, and then you can start with the open-ended question. So always start with the open-ended question. Open-ended question is very important to start your history. Whatever the complaint is given in your paper, this is for the gynec, for the ops, it's always the same, that history should be started with the open-ended question. Whatever the complaint is given, here we can see that chronic pelvic pain. So you can ask that, can you describe me more about your pain? Might be the role player will give you only the one line answer. So you have to then explore that particular complaint. Here you can see in the clip that doctor will explore more about the pain, okay. And in the exam you have to do the same. You have to explore more about that particular complaint. If the pain is there, if the bleeding is there, whatever the first complaint is there, you have to explore more, that since how long, what's the relieving, what's the associated factor. um, Explore more about that, how, if the bleeding is that, how much the usually they are soaking the pad, the bleeding is regular or irregular pattern, and there are clots are there. So that's how you have to explore and expand that particular complaint. In the, at least you have to give a 45 second, at least give a 45 second out of this 7 minutes to explore that particular complaint, whatever the given complaint is there. So pain is there, you have to explore more about the pain. Bleeding is there, you have to explore more about the bleeding. Whatever the complaint is, you have to explore more, okay. Today we are discussing about how to start your long case, and those doctor who are finding some confusion on about the long case for Mrcpi exam, please approach me. I'll clear your all the confusion. I'll try to clear all your confusion, okay, and either paid or non-paid members. But I'll welcome all the candidate to clear your confusion, and you can ask me any question about the long case or OSCE Mrcpi exam, okay. And one more tip I wanted to give through this video, that one paper and pencil will be given to you, will be provided to you on the table to write down the history. Of course you don't have a time to write full detailed history, but at least you can write the risk factor. For example, what I remember from my long case, that I remember that my long case was about endometrial hyperplasia with atypia, and patient in the history. They have given me the history about the obesity, diabetes, and family history of colorectal cancer. So what I have done, that all the risk factor with the she is given to me, I have marked one. I have create one blog for the risk factor, and I have written all the risk factor on that. That BMI is 45, and diabetes and colorectal cancer. So during management part and during diagnosis part, it was very easy for me to make the diagnosis and to go with the justification with this risk factor to provide the correct management, to give the correct management for the particular case. Okay. uh, Always make one block for the risk factor while taking the history. You cannot write down all the history point on the paper, but use the paper and pencil to mark the risk factor at least. During the exam nervousness, you will not forget. At least when you are giving the diagnosis, you can give a one look to your paper, might be the correct diagnosis will come, and you can approach toward the correct diagnosis. That's very important. um, the second important tip I wanted to give, that the first tip is always with the paper. On the paper you can make one block for the risk factor. The second important tip is whatever the paper is provided to you. We all know that we are starting with the presenting campaign and HOPC, but of course with the exam nervousness we can forget some time past medical history, surgical history, ops history, any history you can miss if it is a ops case. So make a block either in your mind or either on the paper: medical and surgical, um, ops history, gyne history first, because we are giving the ops and gyne exam. Medical, surgical, allergic history is very important, and personal history, which include the smoking, alcohol, and BMI, family history, and medical history. So make always a block, and whenever you are practicing for the exam, always use the same sequence so you will not forget in the exam um, some relevant history which are very important for the long case exam. Okay, now we will see the second clip and we will discuss on the second clip as well. Okay, let's review the second clip. Okay.
Could you please describe a pattern? Is it a sharp stabbing sensation or a dull, constant ache before or during your menstruation period? And has it changed over the last few months?
Okay, I think you have seen the second clip of this video, and in this video doctor is trying to exploring more about that particular complaint, which is the pain. So the most important tip today I wanted to give you: don't move to the other complaint, don't jump to the other complaint without exploring more about that particular complaint which is given to you. Here the complaint is given that chronic pelvic pain. Now you have to explore that complaint, at least stick to that complaint 45 seconds and give that time to that particular complaint. And believe me, if you are exploring that first complaint with whatever is giving, you can make the diagnosis on that time. And even if you are making the diagnosis, then you have to rule out all red flags and differential as well. This is your responsibility, but at least the diagnosis will be clear to you if you are sticking to that particular complaint. Okay, because it's a duty of the role player to provide you the um, all the lines whatever given to them. And when you are exploring that particular complaint, so during that question and answering, you will find the diagnosis. Then you have to explore the differential diagnosis, and you have to ask more history, past ops, gynec history, if she's trying to conceive or not, if she's having a baby or not, if she is using any contraception, uh, past gynec history. Pap smear history is very important, the gynec. Then past medical, surgical, family history, personal history. Whatever the template I have given you, you can follow the same template or you can make your own, but always make one sequence, that this is the sequence I will follow. Make yourself more organized by taking the history and make one sequence to follow in the exam. and make your one sequence for organize yourself one sequence and follow that sequence during practice as well, so you will not forget in the exam. So I will end this video. Okay, I'll add further video clips with this video as well, and you can see that video clips that how the doctor is approaching. We will not give you the full detailed medical surgical, but at least the start of the case, that how the doctor is approaching towards the case. Okay, and here in one video clip you can also see that doctor is trying to ask some, you know, sexual history, intercourse history, and she'll give some signposting before starting that, because this is something which is personal, and she's giving signposting to the role player that it is a very sensitive question to ask you, and but it's very important to ask from you, because she is trying to, you know, make a diagnosis, and diagnosis more going toward the endometriosis, and that's how she's approaching towards the case. So you can see the video clip. Look, the video clips I am attaching with this video only, and you can see the video clips. I'll end this my video site, and you can watch further on the another clips as well in the sequence. And but before ending to the clip, this 1 to 2 tips which we have learned today. One is the risk factor table you have to make on the paper, whatever the provided to you, the paper, you have to use that paper. Please use that paper, it's very important. But try not to copy and, you know, paste all the things. You don't have enough time to write all the things, but at least the risk factor you can write. If the patient is obstetric case, you can write that. If the previous cesarean section, you can write the patient is previous 2, previous 3, whatever the cesarean section, or in any complications there in the cesarean section, you can write on the risk factor. That's very important. Okay, before ending this video, I wanted to share one case in which the candidate attempted the exam, and what happened in that exam with the candidate, that patient was a previous 3 cesarean section, and they forgot to ask the past obstetrical history. Even I know this is very important history and it should not be forgettable, but with the exam nervousness, anything can happen with anyone, so we cannot judge anyone, but of course it can happen with anyone. So to not forget that particular history which is very relevant, make your sequence. This is the second tip which I have wanted to give you. Make your sequence, organize yourself during the long case history. And the third is open-ended question you have to ask. Greet your examiner, introduce yourself with the patient, and that's how you have to approach with a long case. Setting, already I think it's clear to you in your mind that how the setting would be. In the long case, I have tried my best to show you how the long case would be in the exam, and in the more video we will more discuss about the long case and OSCE. Thank you. Bye.
I'm sorry to hear how much this is impacting you. On a scale of 1 to 10, how would you rate the pain on your worst days? I know this can be a sensitive topic, but it is important for me to understand your symptoms. Do you experience any pain during sexual intercourse? Do you notice any pain or bleeding when opening your bowel? For me,